So now we're going to talk about the serology of hepatitis virus B. And in order to do that, we're going to make a graph. Where here on the horizontal axis we would have the time in month. So time post-infection. Post-infection. So 1, 2, 3, 4, 5, 6, and they would have a year, 2 years, and so on. Alright, so now we're gonna make an approximate plotting of the ratio of certain antigens and antibodies that will raise or fall throughout an infection with virus B. Now, we are going to talk about those antigens. The structure of the virus, we would have a surface and we would have a core. And for example, we have an antigen which is found on the surface of hepatitis virus B. This antigen is called HBS for surface, HBS antigen. Alright. We have two other antigens that are found in the core. One is called HBC for core antigen. The other one is called HBE antigen. E is excretory. So this one is responsible for the active production of the virus. Is responsible for the active production of the virus and thus for the virulence of the virus. And it also happens to be found in the core. Alright. So what happens throughout the infection? Here around the second month we would have a peak and then a downslope again like that. That peak is an increased production of HBS antigen by the virus. The downslope is HBE antigen by the virus. Alright. At the beginning of this raise in the curve, we would have a reaction from the body, which is the production of antibodies. We would have a production of antibodies against this core, the core antigen. Like that. So, antibodies to HBC. And also we would have a production of antibodies against the E antigen, the excretory antigen. Then we would have the 6-month period. So post 6 months the infection is considered chronic. But before this 6-month period there is a period of around 2 months which is called window period. Window period. This window period means the period where the production of antigens and antibodies are equal. So you can detect neither of them because the antibodies will bind to the antigens, they'll never find free antigens or free antibodies to detect. And this is why post 6 months of infection you would have or you will detect, in other words, the presence of antibodies to the surface antigen, because we didn't mention it here. So there, after the 6th month, you would have the presence of antibodies to HBs. Alright. Now, here is the thing, how to differentiate between, we have acute and we have chronic hepatitis. Also, a very important agent, before I forget, that we use in serology, we have the delta agent. The delta agent is for hepatitis virus D, HBV. As we mentioned in the previous video, that the infection of virus D will be a co-infection with virus B because there is a defect in the surface antigen of virus D. So if you detect the delta agent, it means that there is also an infection with hepatitis virus D. Alright, now for acute infections, you would detect the HBs antigen. It will be positive. For chronic infections, you would detect antibodies for HBs. Antibodies for HBs. Also, another important thing to mention is, for example, for the core antibodies, we have two types, IgM and IgGs. If you detect positive IgM and negative IgGs, IgM is increased in case of acute infections. So it will be around that period, around here. You would have positive IgMs, antibodies for the core antigen along with HBs. It's an acute infection. If you detect antibodies for HBs, which are those ones, you would have a chronic infection. If you also detect antibodies for HBe, which is excretory, it means that the activity of the virus is still persistent and the body is trying to produce antibodies against it. And that means that it's a chronic active hepatitis, If you don't find this, it means that it's just a chronic hepatitis, it's not active. So this is how to apply the serology and use the antigens and antibodies in order to understand the state of the patient with hepatitis B. I hope it was easy, and in the next time we're gonna talk about HIV. So until then, I thank you for watching and see you.